Have you ever sat in the bathroom for an hour with an intense urge but nothing happens? You feel the pressure and exhaustion. But understand this. This is not just constipation. After age 60, this can become a genuine medical emergency known as fecal impaction. It's a severe blockage your body cannot move alone, which can cause toxins to reabsorb. Watch for critical red flags like nausea, fever, or sudden mental confusion. Waiting 24 hours can turn this into a surgical emergency. Call a doctor or visit urgent care immediately. Don't wait. Pressure without release is serious. Your life may depend on it. My name is Dr. John, and today we are going to talk openly and honestly about one of the most uncomfortable, yet incredibly common, health problems older adults face: stool becoming trapped inside the rectum. We are going to discuss what is actually happening inside the body, why aging dramatically increases the risk, the dangerous warning signs most people ignore, what you should never do, and the exact step-by-step approach doctors use to treat it safely. This may not be the easiest conversation to listen to, but it could genuinely protect your health or even save someone you love from a very painful hospital visit. And before we begin, if you have ever struggled with constipation, difficulty emptying, or sitting in the bathroom feeling blocked, type yes in the comments, because millions struggle silently, and almost nobody talks about it. Now let us understand what is really happening inside the body. Imagine your digestive tract like a slow-moving highway. For decades, traffic flows normally. Waste enters, waste exits. The system works beautifully. But gradually, over time, the traffic begins slowing down. Not all at once, not dramatically, little by little. Maybe you stopped walking as much, or your water intake decreased. And then one day, traffic stops completely. That traffic jam inside the body is what doctors call a fecal impaction. This means stool has hardened into a dense mass that physically cannot pass. Normally, your colon has two major jobs: move waste forward and absorb water from that waste. Enough water is absorbed to form a normal movement, but not so much that it becomes rock hard. The problem is that aging changes this system. After 60, the muscular contractions of the colon, called peristalsis, often become weaker and slower. These are the waves that push stool forward. With age, those waves weaken. So instead of stool moving smoothly, it sits and sits. While it sits there, the colon continues pulling water out of it, day after day. Eventually, it becomes impacted. Once that mass reaches the rectum, it may be too large and rigid to pass naturally. People often begin panicking. They strain and push harder. But the more they strain, the worse the inflammation becomes. This is where things turn dangerous. The rectum sits right next to the bladder. When it becomes severely overfilled, it starts pressing on surrounding organs, which affects far more than just your bowels. This is why many suddenly develop difficulty urinating, weak flow, or constant pressure. Some even think they have a urinary infection, when the real problem is severe stool buildup compressing the bladder. There is another symptom that confuses people even more: diarrhea. They think, how can I be blocked if liquid is coming out? This is called overflow diarrhea, and it is extremely dangerous. Liquid waste from higher in the intestines leaks around the hardened blockage. If you take antidiarrheal medication now, you accidentally make the blockage dramatically worse by slowing movement even further. Medications are one of the biggest hidden causes. Opioids, iron supplements, and certain blood pressure medications all rise the risk. When multiple meds combine, the danger increases sharply. Reduced mobility and dehydration are also major factors. Walking stimulates the intestines. When someone becomes less active or their sensation of thirst weakens with age, the system slows down. Finally, ignoring the urge to go is common, but repeatedly suppressing bowel urges retrains the rectum to become less sensitive. Eventually, the body stops giving strong signals altogether. Now, what should you actually do if this is happening right now? First, and I cannot stress this enough, stop aggressive straining. Force is not the answer. Softening the stool is. Glycerin suppositories are available over the counter and work by drawing water into the stool. But timing matters enormously. Most people use them incorrectly. Here's the proper method. Lie on your left side to follow the natural anatomy. Insert it gently, then stay lying down for at least 30 to 45 minutes. If you rush to the bathroom too soon, it won't have time to work. If the first attempt fails, walk gently for 15 minutes to stimulate contractions. Then try a warm saline enema. The goal is to hydrate and soften the mass gradually, with patience. But if nothing works, or if you have severe pain, vomiting, fever, or bleeding, you need medical attention immediately. At the hospital, doctors can evaluate for obstruction and treat it safely. Manual disimpaction sounds frightening, but patients almost universally describe overwhelming relief afterward. It is a safe procedure performed by trained professionals to break up the mass. Once cleared, your rectum will be irritated for several days. Warm sitz baths can help tremendously, and sticking to soft foods like oatmeal and soups will make recovery easier initially. Long-term prevention rests on 4 pillars. Pillar 1 is hydration. Water keeps stool soft. Drink small amounts consistently throughout the day rather than large amounts all at once. Pillar 2 is movement. Walking is one of the most underrated digestive treatments. Even gentle daily movement stimulates bowel activity naturally and keeps things moving. Pillar 3 is fiber. Steady, consistent fiber from oats, vegetables, and beans is key. But remember, fiber without water can worsen constipation, so they must work together. Pillar 4 is routine. Your colon loves rhythm. Relax, do not strain, and consider using a small stool under your feet to help the body relearn its natural patterns. Persistent constipation is not something to ignore. Your body is trying to tell you something. Listen to it early, drink your water, and take care of your digestive health before it becomes an emergency.